Hello everyone and welcome to Simplified. My name is Dr. Shubham and today we are going to discuss the management protocol for pediatric age group that is the age group of child, right, in COVID-19. Why I am discussing this right now because right now we are at the end of May month in 2021, and from the June in India the third wave is expected to be there of COVID-19. And in the third wave, the most affected population, which is expected, is the pediatric age group. So government is preparing very well for that. And it is very important that we as a physician, as a medical student, or even as a normal person should know some basic about the management protocol of COVID-19 so that we can manage at least the child at home if he is having a mild disease. So let's go further. COVID-19 management protocol for the pediatric age group. So first we'll discuss the clinical symptoms, right? Severity of the disease based on the clinical symptoms. So first comes the mild disease. In mild disease, the child will have sore throat, rhinorrhea, cough, but the child will not show the symptom of fast breathing. If he says that if you suspect fast breathing in the child, then it is converted into moderate disease, not mild disease, right? So in mild disease, sore throat, rhinorrhea, cough, mild fever can be the clinical symptoms in the child. But when the fast breathing comes into the play into the symptoms, that is fast breathing, we have it according to the age based. If the child is less than 2 months, more than 60 breaths per minute is fast breathing. For 2 to 12 months, it is more than 50 per minute. For 1 to 5 years, it is more than 40 breaths per minute. And for more than 5 years, it is more than 30 per minute. This is the age-based criteria for fast breathing. And if the child is presenting with the fast breathing symptoms, is showing fast breathing with this age-based criteria, then it is categorized as a moderate illness or moderate COVID-19 disease. But in the moderate, the child will not show any sign of severe pneumonia. If he or she, the child, shows the signs of severe pneumonia, then the disease is calculated as a severe COVID-19, right? For mild, sore throat, rhinorrhea, fever, cough, no fast breathing. If fast breathing is present, then it is moderate. But moderate will have pneumonia-like symptoms, but the symptom of pneumonia will not be of severe pneumonia. If it is a severe pneumonia-like symptom, then it is a severe illness. And what we'll see in severe illness, severe pneumonia, ARDS, acute respiratory distress syndrome, sepsis, septic shock, multi-organ dysfunction syndrome, that is MODS, or a child with pneumonia with any of the following three things or four things. One is cyanosis. If the child is bluish in color along with the pneumonia, it is a severe illness of COVID-19. If the child's saturation SpO2 is less than 90, then it is severe pneumonia, severe COVID-19. If he is showing increased respiratory effort, grunting sound is there, or severe chest retardation can be seen, or the child is lethargic, or there is a seizure, epilepsy attacks, or he is showing somnolence, this all is categorized as a severe illness symptoms. So this was the clinical symptoms based severity of COVID-19 in the pediatric age group. Now we will go further and let's try to know how we are going to manage this children's according to the severity of the disease. So first we'll talk about the mild case. In mild case, what is important? The child will be in home isolation. The child will be given supportive care, and rest is very important in the child. Let the child sleep as much as he can and take rest as much as he can. Give adequate hydration. Very good amount of oral fluid should be given. Good amount of feeding, and for only medication which is given in the child with COVID-19 in a mild disease is paracetamol, that is 10, and the doses is 10 to 15 milligram per kg per dose. In one dose, you can give 10 to 15 milligram per kg according to the weight of the child for fever, and you can repeat it 4 to 6 hours in a day. After 4 to 6 hours, you can repeat the same dose. And if the child is in at home isolation and you can see any worsening sign or the danger sign in the child, you should report to your healthcare worker or the doctor under whose supervision your child is in home isolation as soon as possible. So now that was the brief idea. Now let's talk in detail about the treatment. For fever, in the mild case, I already told 10 to 15 milligram per kg per dose, and we can repeat this dose for every 4 to 6 hours. Right? This is the only medication we give. For cough, we can give throat soothing agents like warm saline, gargles in older children and adolescents. In the neonates, it is not. It is prohibited if it is a mild case. Fluids and feeds, I have told you, ensure oral fluids to maintain hydration and nutritious diet. Antibiotics is not indicated in case of a mild disease. And then there is a no role, very important, there is no role of the tablets like HCQ, hydroxychloroquine, Fabiflu, ivermectin, remdesivir, lopinavir, immunomodulators like tocilizumab, interferon B1 or convalescent plasma, or even steroids. There are no role of this, all the bunch of medications in a mild case of COVID-19 in a child. Only and only medicine which is to be given to a child of a mild disease of COVID-19 is paracetamol, and that dose should be 10 to 15 mg per kg per dose. Now, what should you do if you're monitoring a child at home with the COVID-19 disease and a mild severity? So first important thing is you should monitor a chart, right? And the chart should include the respiratory rate 2 to 3 times a day, and the respiratory rate should be taken when the child is not crying, right? And how will you measure the respiratory rate? Look for the chest indrawing or the abdomen, right? How many times the abdomen goes ups and down. If it goes 16 times, the respiratory rate is 16, which is very rare case. It is very less if the child is very less age group. So also you should measure the urine output. You should look for the oxygen saturation, use a pulse oximeter at home. And urine output is very important. So if you give a very good amount of oral fluids, then the urine output should be there. And that is very important to know. If feasible, fluid intake also should be measured, that how many amount of fluid a child is taking in a day, activity level, especially for the adolescent or especially for the young children, and report bluish discoloration of the body or cold extremities. If your child is having bluish discoloration, report as soon as possible to your doctor, because bluish discoloration means cyanosis, and it can be a case of severe COVID-19, not a mild disease or not a moderate disease. And there should be a regular communication to the doctor or healthcare worker if you're monitoring your child at home. So very important, respiratory rate should be done, checked twice, 2 or 3 times a day when the child is not crying. Okay, you should measure urine output, you should check the oxygen saturation, you should measure the temperature the same time when you measure the oxygen saturation, and should be fluid the fluid intake should be high. So, and you should measure the urine output, report the bluish discoloration as soon as possible. So this was how you monitor your child at home. Now, if your child is having a mild disease, right? Usually the comorbid disease, usually patient tend to come to the hospital and get admitted. But if the child is having a mild disease of COVID-19 and he has a comorbidities like congenital heart disease, chronic lung disease, or chronic organ dysfunction, or the child is obese from the birth, or at the whatever age group the child is and he is obese, he or she is obese, the BMI is more than 2 SD, the child should be managed at home, right? Even if the child is having such comorbidities like congenital heart disease, chronic lung disease, you should try to manage the child at home and make sure that the child, the parents or the person who is monitoring the child has an easy access to the health facility if in case any case of deterioration is seen, right? So child with comorbid conditions should also managed at home if it is a mild disease, and should have a regular contact with the healthcare worker. This was all about the mild disease. Now, if the child has worsening sign and you ran to a hospital, and what a healthcare worker in the hospital should do, first he should evaluate all the admitted child of mild disease with CBC, LFT, RFT, right, coagulogram, CRP, D-dimer, fibrinogen, and chest X-ray blood culture. If the child is admitted in the hospital, avoid nebulization, and use MDI, metered drug inhaler, and spacer if inhaled medication is indicated. What is MDI and spacer? This is MDI, right, which we use usually for asthma pump, metered dose inhaler, or we can use a spacer. So this was all the thing you should know to manage a child of COVID-19 with mild severity at home. Now we will talk about the moderate disease, right? So if a child with COVID-19 having a rapid respiration, it will be considered as a moderate disease. So what is rapid respiration in a child? I've already mentioned it once. Let's repeat it once again. Age less than 2 months, respiratory rate more than 60 per minute is rapid respiration. Age 2 to 12 months, respiratory rate more than 50 per minute is rapid. Age 1 to 5 years, respiratory rate more than 40 per minute is rapid. Age more than 5 years and respiratory rate more than 30 per minute is rapid respiration. Also, a child is having oxygen saturation above 90 but less than 94 will be considered as a moderately affected COVID-19 disease. Child with moderate COVID-19 disease may be suffering from pneumonia, which may not be clinically apparent. Investigation to be done. No lab tests are required routinely unless indicated by associated comorbidities. Right? A child with moderate COVID-19 disease, no lab investigation tests are required, and for mild also no lab investigation are required. If the child shows worsening sign in case of mild, you run to the hospital and there the lab investigation will be done once. Similarly, if the comorbid condition is there in a moderately affected child, then only for that comorbid condition you should do the lab investigation. Rest, nothing is indicated. Now, once again, moderate case, fast breathing is important and no signs of severe pneumonia. If severe pneumonia signs is present, then it is a severe case of COVID-19. So, admit the child as soon as possible, monitor for progress, feed and fluids. Avoid dehydration or overhydration in a child. Antipyretic, that is a paracetamol, is given. Amoxicillin if suspicion of bacterial infection. In mild case, we were not giving any antibiotics, but in case of moderate, if there is a suspicion of a bacterial infection, we can give amoxicillin. If SpO2 is less than 94, start oxygen and add steroids only if very rapid progression, right? If SpO2 starts falling very rapidly, then only give the steroid in a moderate case, or else there is no requirement to give a steroid in a moderate case of COVID-19. Now, children with moderate COVID-19 disease should be administered. For fever, you should give paracetamol, the same dose, 10 to 15 mg per kg per dose, and may be repeated every 4 to 6 hourly. And when should you give paracetamol? When the temperature of the child is more than 38 degrees Celsius, that is, or more than 100.4 degree Fahrenheit. Amoxicillin is to be administered if there is a evidence or strong suspicion of bacterial infection. In mild case, we were not any antibiotics is not indicated. For SpO2 less than 94, supplemental oxygen can be given, and corticosteroid can be given only if the saturation is decreasing very rapidly. Right? In all cases of moderate illness, steroids is not indicated, especially during the first few days of illness. And supportive care for the comorbid conditions should be given if any is present. Now, a child with SpO2 less than, till now we have talked about the moderate COVID-19 disease. Now, let's talk about the severe COVID-19 disease in a child, which is very important. Child with a SpO2 level less than 90 are categorized as having severe degree of COVID-19. Right? Such child may have severe pneumonia, ARDS, septic shock, MODS, or pneumonia with cyanosis. This I have already mentioned when I was explaining the classification of the diseases. Right? Clinically, such child will present with grunting sound or severe retraction of chest or seizure, etc. So they should be assessed for thrombosis, HLH, that is hemophagocytic lymphohistiocytosis, and organ failure. Investigation which should be done in this in the child with severe COVID-19 disease are complete blood count, that is CBC, LFT, RFT, and chest X-ray. In case of severe COVID-19 illness in a child, you should admit the child in ICU or HDU if the child is having ARDS, sepsis, septic shock, or MODS. And when you admit such child, you should evaluate the thrombosis for HLH, and for organ failure. And steroids are given in the case of COVID-19 with severe illness, and the use of remdesivir is not strongly indicated because there is no trial still date for remdesivir for the children, right? So steroid plus or minus remdesivir. Then empirical antimicrobials can be given in severe case of COVID-19. Oxygen therapy, nasal prong, face mask, HNFC, non-invasive trials, SpO2, oxygen therapy should be given with all this, and the target for SpO2 should be 90, more than 94 during resuscitation. Once the child is stable, then the target is more than 90%. Consider awake prone positioning in older child, restrictive fluid therapy, and organ support. Now, suppose the child is suffering from ARDS. So what we'll do, if it is mild ARDS, then we'll give HFNO or NIV trial. If it is a severe ARDS, then mechanical ventilation should be given with low tidal volume, right? That is 6 ml per kg and high beat. Cuffed endotracheal tube should be done, and fluid resuscitation, sedation. If the child is giving poor response, we can try prone ventilation also. Now, if the child is in septic shock or myocardial dysfunction, crystalloid is to be given in bolus form 10 to 20 ml per kg within 30 to 60 minutes. And if the child is hypotensive, give it more fast, right? Careful administration should be done if myocardial infarction is suspected. Early inotrope support is to be given, and you should monitor for the fluid overload. Now, once again, in case of severe COVID-19, right, steroids, which is indicated, that is dexamethasone, and the dose is 0.15 mg per kg per dose, right? And maximum how much we can give? 6 mg. And this dose can be given twice a day for 5 to 14 days, depending upon how the clinical response is, right? And equivalent dose of methylprednisolone or prednisolone can be also given. I already told about remdesivir, no trial data in children. Its use is restricted to severe cases presenting within 72 hours of onset, provided the LFT and KFT are normal, right? If the child comes to you, you can give him remdesivir in the initial 3 days, but before starting the remdesivir, you should go for check for the LFT and KFT. If it is in the normal range, then only you should give the remdesivir to the child with severe COVID-19 disease, and that too in the initial 3 days when he or she comes to you. And what is the dose? If the child's weight is more than 40 kg, you should give the same dose what we give in adults, that is 200 mg on day 1 and then 100 mg once daily. And if the child's weight is 3.5 to 40 kg, then the dose should be 5 mg per kg on day 1 and then 2.5 mg per kg once daily, and the duration is 5 days. Now, once again, the treatment of severe COVID in detail, right? First, intravenous fluid therapy is to be given, then corticosteroid can be given, and the dose and the preferred one is dexamethasone, and the dose is 0.15 kg, 0.15 mg per kg per dose. And maximum how much we can give? We can give maximum 6 mg. Maximum 6 mg. Twice a day is preferred. An equivalent dose of methylprednisolone or prednisolone may be used for 5 to 14 days depending upon the clinical assessment, right? And if you go further, what we can give? Antiviral agents like remdesivir, right? So remdesivir is an antiviral agent. I have already told there is no clinical data in children of use of remdesivir. So when you can only give remdesivir in case of severe COVID-19 disease in child, and that too within 3 days, and that too while giving you should have the sufficient data of the RFT and KFT which are in normal limits. Suggested dose, I have already told, if it is more than 40 kg, then the normal doses what we use in adults, that is 200 mg on first day and then 100 mg in the next 4 days. And if the body weight is from 3.5 kg to 40 kg, then 5 mg per kg on day 1 and then 2.5 kg, 2.5 mg per kg once daily for 4 days. No role of HCQ, favipiravir, that is Fabiflu, or ivermectin or any other diseases, right? Children may need organ support in case of organ dysfunction, example, renal replacement therapy. So this is how treatment of severe COVID disease is to be done. There is another disease in the child with suffering from COVID-19, that is multi-systemic inflammatory syndrome, also abbreviated as MISC. I will try to make a separate video on that topic, and I hope this protocol of COVID-19 management style is very clear to you, and hope this video is useful for everyone. So thanks for watching the video. Hope you find it useful. Do like, share, and subscribe my channel, Medi Simplified. Thank you.